as you all quietly wait.
I know. Like literally 3 p.m. I'll start with a brief intro about SAEW, just so for anybody that's new, and I'll kick it to you, Monique, so you can introduce the group.
No problem. And yeah, we've worked with Launch ever since the beginning with IED, and we've taught a couple of courses and classes and sessions and fireside chat. So this is all, you know, different, but it's cool.
I know. It's a new year for us too. So I just want to make the best out of everyone's time. So I'm going to start with just thanking everyone for joining us, especially to the speakers and anybody else who might be catching the session after or right now. This is San Antonio Entrepreneurship Week. As I mentioned before, we started in 2016, putting this week together as a celebration of entrepreneurs, small business owners in San Antonio, celebrating by sharing local stories and perspectives of small business owners. I think it's very important to relate back to our community. And that's why I think this year more than ever, we need to do that, share perspectives and stay together. So the theme for this year is resilience, and how are you able to still keep going and find strength and inspiration among each other. I also want to thank our sponsors for this year. We have the City of San Antonio Economic Development Department, which is one of our big partners, and then Lift Fund as well. They're both doing great work for small business owners. So if you're not familiar with them, I invite you to go check out their work. There's programs being rolled out for entrepreneurs and small business owners throughout this pandemic, and even before that, opportunities for you to just take benefit of. And we also have Open Security and Trinity University as sponsors, so thank you. And finally, I want to just thank everyone that's here and ask the participants to relate any questions to the chat. Even if you're on YouTube, we'll do the best to relay those to the group. That way we have an engaging conversation. Anybody coming in will be muted, and we ask that, I mean, I think we're going to have a small group, so you can unmute yourself, but do it at the end of the session. That'll be great. So thank you again, and just Monique, if you want to start. Oh, lastly, there's a survey, so make sure you complete that. That gives us great feedback and just constructive work to work on for next year.
Thanks, Daniela. And thanks everyone for attending. So right as Daniela said, you know, this resilience thing is very, very necessary for small businesses, and especially innovative small businesses. We thank you guys for helping us to host this and give us a platform. We are the UTSA Technology Commercialization Center, TCC, and what we do, we serve as the specialty center for the Small Business Development Center, SBDC, the regional, and we also serve as the state-appointed center for SBIR, STTR assistance, and we can talk a little bit more about that if you're interested. And we also serve as advisors for any advanced science and technology innovation companies that are anywhere in the process between ideation and market. So that's what we do. I'm Monique Long-White. My colleague, Dana Fisher, we're both over in the corner. We're both project managers at the center. And yeah, so we are able to call on a couple of our experts. I'm calling them experts. They're our clients that have gone through the virtual competitions. They've gone through winning, which is awesome. So congratulations, guys. We also want to congratulate Terra Biotech and Patch, and they'll all introduce themselves. But yeah, so they're all winners of amazing competitions, but they've also have to pivot and think about how COVID-19 has impacted them. So we get a chance to discuss this a little bit and see what's on the horizon for each of these teams. So Dana, you want to start off with introductions of the teams? I think you're muted.
Some people are more technology challenged than others. So good afternoon, everyone. It's a pleasure to be meeting with everyone. And we are so appreciative of this opportunity to showcase these amazing innovators and bring them to an audience, a platform that maybe they wouldn't have normally have access to. So the purpose of this particular section that I'm going to be moderating is essentially about the companies and their innovations and their teams. There's 4 minutes allowed for each team to address the questions. What we're interested in finding out is a bit about your background in terms of your innovation. You know, tell us a little bit about your innovation, tell us a bit about your company or team, about your employees, your space, your just set the stage essentially for our discussion this afternoon. And I'm going to start with Patch RX, Gavin Buchanan. So if you could just take it.
Great, thank you. So I guess going back a little bit, I started my my venture in my first year in college, and I graduated this May, and we're still going strong. We won the Stumberg Venture Competition back in 2017 academic year, and so we have experience. We've done 3 or 4 other competitions where we were finalists, and I suppose that over the last 3 years we've grown tremendously. Originally, it was just me and my co-founder. And here we are, 4 years later with a group of 10 people, 10 employees, a partnered engineering firm, and lots and lots of mentors, investors, and advisors all around the company. So we've done everything from build 3D models in the basement of a library when it was just 2 students with kind of an idea, and gotten ourselves all the way through to Series A funding, and we've all worked very, very hard over the past few years, and I suppose we'll probably have some COVID related questions, but that's definitely been a big game changer for us. Our solutions are based on solving the issue of non-adherence in the healthcare realm. So when people don't take their medications properly, it causes all sorts of negative effects and negative health outcomes. The first place that we figured this out was in clinical trials, when we developed our first solution, Patch Trials, which went on the marketplace a little over 2 years ago, and was had a large demand for it. And we've been working on that solution and servicing clinical trial research companies ever since. And over the last 7 months, we've been working on our new solution, Patch RX, which is trying to solve that issue of non-adherence in pharmacies. Last year, the national prescription adherence rate was 50%, which means that for every pill prescribed by a doctor, only half were taken properly. That led to something like 125,000 deaths and lots of hospitalizations, and is estimated to have $300 to $400 billion impact on the healthcare industry. And right now, especially in the retail pharmacy space, no one's leading the charge to make a really big change in that. So we've been working on developing a solution, and are excited to say that we've got a couple of pilot tests with some retail pharmacies and one large retail chain pharmacy that we're excited about. So I'll switch over to whoever's next.
Okay, thank you, Gavin. That was very informative. So Jenny Yoshimoto of Terra Solar, you're up next. And you'll have to unmute. Perfect.
Got it now. Hi, thank you for having me. I'm the founder and CEO of Terra Solar. We're developing a simple assembly solar kit. You can put it up yourself, and then when you decide to move homes or your business, you'll be able to move it with you. So it's really about increasing the accessibility of solar to more people, and reducing installation costs. So I came up with this because when we moved into our house here in San Antonio, it's our first house and it needed a lot of work. I was doing flooring and drywall and tiling and everything, but there didn't seem to be a simple solar solution. So I started on this path. I got connected with Dr. Monique Long-White early on and have been working with the Small Business Development Center, which has been tremendously helpful. I've been able to apply for lots of different grants, and this February, I won one from the Department of Energy through a contest that they have called the American Made Solar Prize. So it's a crazy contest that we're in. Thank you. And it's very fast moving. So on Monday is my deadline, and half of the teams at this stage will move on with more funding, and then they've got 3 more months and then more funding. So yeah, it's really a push to innovate fast because, you know, with your own businesses, you could go at whatever speed you want, but this is fun. And I've also been able to work a lot with Epicenter. So they're the energy incubator and accelerator here in San Antonio. And I get weekly coaching. Really, it's much more than weekly, but anything I need, it's like they read my brain ahead of time and they're like, hey, I think you need help with this. And I'm like, you're right. So they've been super helpful. I'm also here in my office at Can Opener Labs, which is a prototyping studio. They're the ones building my structure. One person's out in the field right now, putting it up, doing a time-lapse video. And I've also been working with Texas State University. So they have a really cool venture program, which is a pitch competition, which we recently won like a month ago. And besides that, they're very keen on helping startups and pairing them with senior design projects. So if anybody has a need for university students to do some engineering work for them, you should definitely contact Texas State. So I'm just thrilled to be here, obviously. And yeah, we are definitely rolling in the time of COVID. It's a wild ride.
Awesome. Thank you so much, Jenny. That was a great background on your company and where you are. Next up, we have Bianca from Novice Helium.
Hi, everyone. I'm Bianca Cerqueira. I'm the co-founder and COO of Novice Helium. We co-founded, Lauren Cornell, my co-founder, we co-founded Novice Helium in 2015. Our background are both as biomedical engineers, and we have a history of breast cancer in both of our families. So we understood the limitations of current nipple reconstruction techniques. So we have devised an acellular nipple areolar graft for nipple regeneration after mastectomy. So the stage of our company, right now we have three of us. We have Shasta Dallo. She is her background is in immunology, and she's our chief scientific officer. So in terms of our product development, we've gone through laboratory testing to characterize our matrix. We've gone through animal testing to further show biocompatibility. How does our matrix work if you put it inside a body? And then to give you a little bit more background on what an acellular nipple areolar graft is we take donor nipple areolar tissue, process it to remove all the cells and DNA, and what's left behind is the collagen structure of the tissue. So you can implant this onto a patient, and then because the cells are removed, they don't have a negative immune response to it, and then their own cells grow into it, and they're ultimately regenerating a real nipple areolar complex. And current reconstruction techniques are quite limited. The gold standard for surgical technique is the surgical skin flap, where the skin on the reconstructed breast mound is cut and sutured together, kind of like origami, to recreate the appearance of a nipple. And this technique was first introduced in 1946. And is still the standard of care, which is quite surprising. So one major limitation of this technique is that it flattens out over time due to the contraction of scar tissue. And then for desired pigmentation, you have to have a tattoo. And some women decide to do just a tattoo on its own. Another option is a silicone prosthesis. So none of these options allow women to regenerate a real body part that they lost as a result of their mastectomy. So we're working to address that.
Okay. Great. Thank you so much, Bianca. And then next up, we have Ben Johnson from Terra Biotech. And Michaela is on the call too, at least she was, but we're focused on you, Ben, because we can see you.
She's still having a couple of issues.
Okay, no worries.
If I share my screen, I wanted to show you guys like a video clip.
I'm not sure. Where are our hosts?
now.
Okay, he said you can now.
Awesome. 1 second. So to give you guys a little bit of a background, like they've mentioned before, we won the site competition at the University of Texas San Antonio pretty recently. There's just 4 of us. We're a senior design team that's just starting out. We're at the prototype phase, or we were when COVID originally hit. I'm going to show you guys this video so that you can sort of see what our technology and our design is about. And then I'll go into a little bit how we've been compensating with COVID after that.
We are all aware of the current COVID-19 pandemic, but did you know that 20% of COVID-19 cases will end up in the ICU and need to be placed on a ventilator? This means that approximately 20,000 patients got a complication called ventilator-associated pneumonia, and of those, 12,000 will not leave the ICU alive.
When you're on an endotracheal tube, bacteria can gain easier access to the lungs, both because the tube is holding the throat open and because mucus stagnates around the end of the tube, creating an ideal environment for bacteria to grow.
Even outside the current pandemic, pneumonia is the most common healthcare-associated infection in U.S. intensive care units, with about 30,000 deaths per year.
There's no current way to detect that before bacteria grow and overwhelm the immune system, causing life-threatening symptoms. The current standard for detection is a daily blood test, which only indicates a general infection and doesn't tell doctors where the infection is coming from. Furthermore, these tests can take 24 to 48 hours to complete, meaning that if a bacteria infection started on ventilator day 3, it may not be diagnosed until day 5.
So we asked ourselves, what if there is a way to monitor patients' bacteria like the heart and oxygen monitors at every hospital bed already? The current PVC endotracheal tube can be seen here. Our innovative design, which has a provisional patent, is an endotracheal tube with an electrical probe that communicates with a biosensor circuit through electrical leads which travel up inside of the tube wall. Our device uses the mucus that builds up at the end of the tube and analyzes it for bacteria with the electrodes. This will monitor infection-causing bacteria continuously and non-invasively.
Electrochemical impedance spectroscopy was invented to characterize chemical reactions. Our technology allows us to characterize the resistance, capacitance, and inductance of a sample in order to generate a profile and characterize the mucus of a patient's airway.
In the ICU, 54% of patients are at risk for VAP. Even in just the intensive care units of the top 3 hospital systems, that is a beachhead market of 900,000 patients.
By alerting physicians of infection 24 to 48 hours earlier, patients can receive treatment faster and reduce their time of ICU stay by an average of 6 days.
That lowers each VAP patient's treatment cost by $24,000 and saves the healthcare system an average of $3,600 for every ICU patient that walks in the doors.
These are our financial projections for the next 5 years. We'll start with pitch competitions, grants, and angel investors, and then progress to a round of VC funding to initiate product manufacturing and sales.
To summarize, NewMed is capable of monitoring infection as it develops, rather than after patients present with life-threatening symptoms, reducing the burden on healthcare systems and saving patients' lives.
So that's what we've been working on for the past year or so. That video was part of our submission to the National Debut competition, which is sponsored by BME IDEA, and is specifically for undergraduate students who are starting to create their own small businesses based off of the technology they've developed. So we're really excited about that competition, and we're looking for a couple other funding opportunities right now.
Okay. I have one quick question, Ben.
Sure.
Do you have an LLC, a registered business? Is Terra Biotech a registered business? That's your
Nope.
team name, but you're working toward that.
Correct. So as of right now, we have intellectual property protection filed with the founders, but we have not incorporated.
Okay. All right. All right. Well, I think we have heard from all of our teams. So, oh, and Roman. Oh my gosh. Not least, last, but definitely not least. Roman Sandoval from Allison's. I'm sorry, Roman. Go.
No problem. That's no problem at all.
I owe you something for that. We'll have to figure that out.
Well, thanks again for inviting us to be part of this. So we're Allison's. I'm CEO and founder of Allison's Incorporated. At Allison's, we create always connected asset trackers that leverages satellite, cellular, and mesh connectivity. Ultimately, we're troubleshooting and problem solving issues with material management. Right now, we're working with the US Air Force through a small business innovation and research contract, which is the Open Topic 19.3 contract that we have. As part of that, we are understanding more about, hey, how is material management actually working out in the Air Force? And what are the solutions that we can apply to gain insights and understanding to optimize these logistic problems of scanning and redocking of terminals. It's amazing to be part of this sort of program because it allows us to gain insights about how the Air Force works, getting engaged with them to ultimately be a sort of a sole source in sort of the phase 3 approach. Now, our company is comprised of multiple engineers. We're heavy in engineering. In fact, we have 10 people in our company, and we exponentially grew 10x just the past few months. So we have folks from Tesla, Apple, Qualcomm building out our products and devices. Of those 10 people, I'd like to mention a few of them. Chris Benner, whom I worked with out at Tesla working on a Model 3 battery pack. And Brandy Clinard, who's an Air Force veteran who has a secret clearance. And she's helping us understand more about the impacts of our product, also understanding more about how do we navigate around COVID-19, because she was formerly a nurse for the Air Force. Now, I had came from Techstars Boulder 2019 Accelerator program, and this is how our company sort of started. I wanted to create an IoT company that was focused on products that solve solutions to ultimately reduce waste in logistics. And so immediately upon sort of the end of April of 2019, I created this idea. And by 2020 of January 2020, Allison's became a Delaware C corporation, so we could get additional investments and provide equity to all of the other employees and individuals who are heavily contributing to this mission. Now we are still sort of a startup. We're pre-seed, and we are gaining traction with talking to investors, working in the Geekdom pre-accelerator, and also working with TCC. And we're intending to work heavily with Epicenter as well. So with that said, we're Allison's, and thanks again for inviting us.
Great, thank you, Roman. Appreciate your background there. So now I'm going to turn the next little portion over to Monique. And she's going to be looking at virtual competitions and getting responses from you guys on that.
Thanks, Dana. So thank you guys. That was great. Your innovations are so amazing. I'm so happy that we were able to have you on the panel. And one of the other things that you guys all have in common is you're winners of competitions. So and recently too. So that's pretty awesome. And so congratulations again on that. So some of the questions that we want to know, in terms of right now, like we're having SAEW, and this is a virtual platform compared to all the other years, but venture competitions and pitches and all of those are going virtual too. And it is kind of weird based on what you guys tell me. So I would love to hear what are your thoughts? I know most of you have been in in-person competitions and the virtual competitions. And I kind of want to start with Patch, if you don't mind. You guys have, your first competition was back in 2017, 2018. That's when you went through your cohort at Trinity. Tell us how that compares to what you're seeing now in 2020.
Yeah, that's a great question. I think the major difference between being able to be in person is having a product that you can show properly. Whenever you're sharing video, it's so much more difficult to get across what it is that you're trying to demonstrate and present. I think judges, for instance, have a lot harder time staying focused, as we all do on a Zoom call, right? For example, we were part of a pitch competition that we did really well in a few months ago, and I really had to punch up the energy, just because by the time that I came in, we were the last pitch to go. So they had been on Zoom calls for something like 5 hours straight, just waiting in lobbies and out of lobbies. And I could tell that by the time I got in there, their eyes were pretty glazed over. Their energy was pretty low. And one thing that I did was I just opened up the floor at the very beginning rather than wait for questions at the end. I decided to open up questions and just talk to them, ask them how their day was and see if I could do anything to revitalize their energy and break a little bit of the monotony. What one of the judges told me after was that I was the only person that day to just ask them how they were doing and how everything was going. I think it's easy to get lost in the pressure of a competition and forget that the judges are people too, for one, and that two, that everyone's being affected in a similar way, both by doing everything remotely and by the COVID situation. So I think there's a lot to say about engaging differently for people who, there's not the excitement of an event. There's just kind of the monotony of, sitting through a bunch of presentations through a Zoom call in your own home, which you're, familiar with and takes a lot of that X factor of being at, a convention center or being at, a place where other people are gathered. So those are my opinions on how different everything is that the biggest factor that seems to have changed is the way that you interact with the judges and the way that the judges are able to respond to whatever it is that you have to show. Obviously, I think one of the best ways is just trying to interact as much as possible. I know that can be difficult because everything seems to be, kind of a one-way pitch. But the more that you can ask questions or get them to think and not encourage them to kind of stare blindly, because sometimes when you're listening to anyone talk for a certain length of time over a Zoom call, probably what's already happening with me talking right now is that you kind of, you watch the person and then other distractions, you'll get the other people on the Zoom call and you tune out just a little bit. And it's really easy, so easy to just completely lose track of where they're going with their sentence or what they're actually saying. And then you've lost your audience. So that my advice to other people who are thinking about competing or are competing is to really focus your attention on engaging your audience in a way that makes them think and respond and makes yourself memorable and not just we watch so many YouTube videos, for example, and so many videos online, whether it's LinkedIn, Facebook, YouTube, or whatever, that videos or one-way presentations kind of get lost in the memory, just the same way that any other format would. So
yeah, totally agree. Ben, and I don't know if Michaela is still not. Yeah, I see you're trying to come on. But in the meantime, I'll still go to you. You guys started off your competition in person, and one of the best things about SITE, your recent winners of the UTSA SITE 100K competition, is that huge, platform that all the students get to attend, see all the senior designs, get really amped up, and then you hear the competition, and then you're like, yes, there's energy. What was that like in the virtual competition world?
For us, the challenges of like the virtual competition, I'm going to echo what Gavin was saying, and especially for us, before COVID-19 ever happened, we were concerned about entering the competition for our device because we weren't sure that anyone would recognize like endotracheal tube related infections as a problem that needed to be solved. It wasn't sexy, was our concern. And so in some ways, COVID-19 actually really helped us a lot because we just sort of got lucky, and everyone in the span of March learned, oh yeah, this kills a lot of people. It's really important, and a lot of people are suffering from it. So it sort of solved one problem for us, but the other problem of trying to communicate exactly how our device works definitely was different. None of us had known how to use like Adobe Photoshop or Illustrator before the beginning of this event. By the end, we were like semi-proficient. We had a couple of friends who were good with videography. So like it just brought in a completely different skill set to keep it engaging. Again, sort of just to harken back to what was said already. So those I think were the biggest like learning curves for us, was changing that medium from more than just a PowerPoint and being able to be a dynamic in person. Now we had to have dynamic graphics and engaging visuals that would do that for us. So learning how to create those, I think, was the most important switch that we made as a team.
And I have one quick question on that, since we have a little bit of time for you. How does that work with being a student? Yeah,
so,
I'll leave that open for you.
Yeah, it was awful. And I want to say UTSA did a great job. They were very consistent in their messaging and how things worked out. But part of the way the timeline worked for us was we had finished our design and our initial prototypes, and we were trying to go through and troubleshoot and beef up the prototypes before this competition so that we could have some initial data to talk about. And pretty much after the first round of site competitions, where we sort of say what our basic idea is and get feedback from judges, the COVID-19 hit and we were banned from university labs and all of our equipment. So what happened is I showed up on the last day I was allowed to access the lab. I basically, with permission, stole a bunch of equipment, and we tried to make it out of our house with like aluminum foil for electrode contacts and like bath water. So the technical side was extremely challenging, and that's probably the thing that we struggled with the most because of COVID-19.
Roman and Bianca, you both were in the Texas A&M New Ventures competition recently. I guess I can start with you, Roman. You've been in a couple other competitions too. What was that like? And especially since it's a venture competition, the big part was networking. What was the competition like for you? And Bianca, that'll be the same question for you. And then also, what do you have any advice on approaching ventures in a time like this?
Yeah, first and foremost, TNVC is an amazing competition to be part of. And we were sort of recommended by Biju to go after this. He had suggested this as well with the TCC team. Going through TNVC was an interesting experience in that we were actually a semi-finalist alternate. And what that means is that we weren't necessarily pitching our long sort of presentation. Instead, we had an opportunity to make a pitch that was only 1 minute. Regardless, we won $13,000 worth of awards through TNVC. And we also got additional networking and additional people that we were able to talk to after that competition. The application, which you had to download on your phone, allowed you to network with various folks. And I would definitely recommend anyone who wants to go through online competitions like TNVC, which is typically done in person, to just go out there, put yourself out there, and try to see what you could do. But ultimately, TCC has helped us better our pitch, better our presentation that aligned well with what TNVC was looking for. And I'm incredibly thankful for those practice runs. I believe we had 2 sessions, right? One which was like 1 hour and another one which turned out to be 30 minutes. I found those to be incredibly helpful with winning that $13,000 worth of awards. And to mention more about those awards, we received the Paragon Innovations Award, and we also won 3rd place in the pitch competition.
Yeah, congratulations on that, and thank you for the kudos. It was fun walking through those things with you. Our team loves doing that. We get to geek out and talk about this stuff, so it's really cool. Bianca?
Yes. So we were in the TNVC competition last year. So it's interesting to see the comparison of the in-person competition versus the virtual only competition. And I do have to give them major kudos for continuing on. I know that there were other pitch competitions that were just either delayed or they decided to cancel it. So I really thank them for continuing to host it. And I know this is the whole new world for all of us. All of us are trying to figure out, how to make it work. So I think they did a really good job. And again, since it was a venture competition, right, the goal is to network. So again, it is more difficult to do that in person. They did have the phone app, as Roman mentioned, where you could connect to people. So I think you just have to, take initiative to go and try extra hard to contact everyone that you want to talk to. But I think that the foundation they provided for that networking was very valuable. And then just for pitch competitions in general in the virtual space, with TNVC, they had us do a practice run with some judges. And on our first practice run, we were like, okay, we're going to get our office all set up. Let's get the camera, right, all the logistics. And then we realized that our microphone was terrible. So during they were like, what? And they were like, okay, we need to get like a real microphone. And so just, make sure that your audiovisual works really well before these competitions, because nothing is worse than having to just go, what? You're cutting out, you're losing internet. So that's something really important to consider. And then again, we were really happy to win 2nd place in the elevator pitch competition, and then we won the Hollingen $10,000 PR package. So we're really excited and really grateful that they're continuing on. And I think now, as more time has progressed, there are other competitions that are becoming all virtual. So even now, we've applied to an AIM High accelerator. There's a Women Who Tech competition hosted by Google that was delayed, but they're still having it. So, there are a lot of competitions now that are only virtual. So it's nice. So some things you're like, okay, well, I'm not in New York. It's hard for me to, travel there. I don't have the funds. I don't have the time off. Now, because everything is virtual, it's accessible to all of us. So I think that's one advantage that comes out of all of this craziness.
Nice. And Jenny, you are still in the middle of a competition. We kind of pulled you away from recording for this competition that you're pitching to. So tell us what that process is like and what preparation is like for presenting in a virtual competition.
Sure. Well, I would like to echo what Gavin was saying about being high energy. To me, that's one of the most important things. It doesn't matter if you're tired or not. If you're just like, hey, I'm so glad to be here, that just made most of you laugh. Also, I like to know my audience. You definitely want to tailor your pitches to who's going to be actually judging you. So the last 2 competitions that I did, I just directly emailed and I was like, hey, who are my judges? And both times they told me. And I was like, oh, that's great. So then you can study up ahead of time, which you wouldn't think that they would tell you this. But if you just ask, you never know. So if you know who the judges are and what their background is or are, not only would you be able to do a broad overview, but if you know those people or know their businesses, you can call them out. So not only is like high energy grabbing their attention, but if you hear your name or your business name, you're like, oh, what, and you paid a little bit more attention, and there'd be a little bit more personal connection. So knowing your audience and high energy, a huge part of my preparation is taking up offers for help. So we all know people who are like, hey, if you want to listen, or if you want me to listen to your pitch, I'd be happy to. Definitely do that, because like the first at least 3 times I'm doing a pitch, I'm like, what I want to say on this slide is, and it's, you know, terrible. But I just get over that and I'm like, this is my friend who offered, so whatever, they're not judging me. And then by the time it's competition time, it's set and I know what I actually want to say. So just practicing. Also, I like to practice where I'm going to pitch. So this is not my normal space. I always pitch at home, same spot. If I can practice in the same outfit, I do that, just because the more comfortable I am with my settings and, you know, just the whole setup, then what's that?
With a cool picture in the background.
Yeah, I'd have a cool picture. The lighting would be better. Yeah, I would just feel more prepared. You know, you don't want to be like walking out on stage with your pants down. So, yep, that's basically what I do.
I like your background. I also like Bianca and Lauren's background too. They had really cool books. It almost looked like a virtual background, but it was real.
Oh, yeah, it was in our office. So we have a wall of all of our awards. So we like repositioned our desk so that would be our background, and then we had like the lighting and then Lauren does voiceover work, so she has a really nice microphone. So we got it all set up above, like it looks super high tech.
Yeah. So thank you guys. So I'm just gonna, you know, just recap. Make sure you're personal, high energy, know your audience, prepare. Make sure you in preparation, take up help. You know, make sure your AV works. Make sure your background looks good. And the really cool thing right now is that you can access almost any virtual competition because you don't have to be there. You don't need a plane ticket. You don't need funds for that. So yeah, this is great. Hopefully, you know, others will hear this and take some notes. So that was my repetition for taking notes. And I'll pass it back over to Dana.
All right, so this is the portion of our session where we talk about the elephant in the room, or actually the elephant we live with every day that's impacting our personal lives, our businesses, everything in our society. It's such a crazy, unprecedented is the term that people use so often, but I believe it is. So our interest here, and this is, you know, the highlight really of this session, because that's what I think a lot of people can take away in terms of businesses, is telling us how the pandemic has affected your business at whatever stage you are and what plans you had. Maybe they've been put on hold or you've had to pivot, to change, to go a different direction to address these impacts. What about the opportunities? Have you been able to take advantage of some opportunities maybe in a medical field or in some area where there was a need for your product or your expertise? And then what kind of advice you have for people going forward in terms of these changes. So I'm going to ask Bianca to speak on that first.
So we were planning to do large animal pig studies with the U.S. Army to evaluate our nipple matrix. So we were writing the animal protocol, we're ready to go, and then COVID comes and they shut down all research. Like nothing's going on, so we're like, okay, we gotta pivot on this one because we want to, you know, keep moving forward. We don't want to just not do any experiments for a year or however long it takes for everything to get back to normal. So then we decided to do some more rounds of mouse experiments, so at least we can get, you know, more in vivo data. And then I think it was the smart thing to do now because it's kind of realigned our plan to get to market, because initially we were going to test it out in pigs and then after that do like validation of our packaging and all of that. But now we're going to move forward and do packaging validation now. And then prior to doing the pig studies, and then that helps us get our data aligned so that animal data, it's exactly what we would use in humans. So we don't have to like validate it once in the pigs, and then again after we do the packaging. So it kind of aligns and streamlines our plans to get to market. So that's kind of how we've had to pivot.
Okay. And in terms of your award funding, are you using any of those funds that in terms of addressing some of these impacts?
Yes. So right now, all of our award funding is going directly towards our experimentation. So we had enough funding to do the pig studies, but now we shifted some of that to the mouse studies, and then now we're applying towards the packaging validation.
Okay, great. Thank you for that. So I'm going to go next to Gavin with Patch. You guys have, you've seen a lot just in terms of the amount of time you've been involved in your space from your ideation to where you are now. How has the pandemic impacted your current operations and the direction that you're going?
That's a great question. There was a fairly large impact. We had at the time we had five different drug sponsor clients that we were working for, running clinical trials and solving the issue for them. And it was in early December that our manufacturing company told us that they were shutting down, and that completely halted all of our production and what we were doing, and really threw us for a loop. Thankfully, we were at a good enough spot. We had been really frugal in our decisions to spend money on development and on certain things. We always try to balance finding the best value for what we're getting. And we were able to move straight into another round of funding, and started the development of our most recent product, Patch RX. We started that in mid December. It was probably a year ahead of when we thought we were going to go for the next solution, and start developing it. But we decided that everything's kind of halted, everything's kind of stopped. And we foresaw that there was going to be a lot of halting in not just in manufacturing across the world, but in the healthcare space especially. So we started developing Patch RX right away, and we hunkered down really for the last 7 months, just solely working on development, research. The great thing is that with a lot of people working at home or not working at all, you can kind of get an audience with anyone. And so I'd say that's one of the great pieces of recommendation is call people and reach out. We reached out to individuals who we never thought we'd get an audience with, because they're at certain levels in large companies, and they responded in the same day, like, I'm not doing anything but just relaxing in self-isolation, basically. And we got a lot of really great feedback, research, and conversations that way. And then actually in around May, we were at a good enough spot that we were able to release a beta version of our app and software to nursing homes and certain healthcare providers around the local area, who were having issues with making sure that elderly patients who were stuck at home and self-isolated and really couldn't be visited by loved ones to make sure that they were taking their medication, that we had a way of providing some solution there. So we did that completely free of charge, and we kind of pushed our team to work hard on focusing on that as one of our solutions. And we were able to meet a need, and we've been doing that for the last 6 weeks, which really didn't halt our progress. What it did was reinvigorated our team to feel like we were doing something with value and with a cause, and we were having in our own way an ability to help with the impact that was going on by COVID. And we actually released our official app for our new solution, Patch RX, on the App Store a couple of days ago. So yeah, so we've been working really hard, and for us, it's kind of while a lot of people were stopped in place and kind of frozen. We thought this is the perfect time to spend, 50 hours a week working just on research and calling people and talking and making sure that when things open back up, while everything else may seem to have resumed, it'll seem like we kind of jumped ahead. A lot of the people that we spoke to in December, we were like, well, we're just now starting development. And then we reached back out in March and April, and we said, oh, by the way, we're basically done with research and development and are on to manufacturing. And for a lot of them, their minds were blown, because they're like, how have you maintained that level of progress in these times? And one of the ways was being, like I said, really flexible, especially with our team members, making sure that all of our team members were feeling secure. A lot of people were worried about layoffs, worried about the company. And so what I tried to do, even though all of our meetings were virtual and remote, was trying to call everyone, all the people, all the turning points in our company, call them on a regular basis and make sure that I was having a conversation with each individual once or twice a week to make sure that they were feeling okay, just in general, which is something that, when we've got deadlines, when we've got products to move, when we're working really hard, it gets lost in the mix. We forget that, employees and people that are working for us, that, even outside of the company, they've got so many points of stress that we might not be aware of. So to I guess summarize, making sure that the people in our company were taken care of, and we're feeling okay with everything that's going on, and giving them a sense of purpose and value in what we were doing to help make an impact, and then putting in even more effort than we would otherwise to make sure that we're delivering, a solution and product that we're happy about. So.
Thank you, Gavin. That's a great example of refocusing and taking advantage and pivoting of your situation, turning the proverbial lemons into lemonade. So awesome.
Thank you.
All right, next I'd like to go over to Roman. Roman, you were in the middle of an SBIR Phase 1 award with the Air Force when things started shutting down. Can you talk a little bit about how COVID-19 impacted you delivering on your grant and those kind of things?
Sure, yes, I'd love to talk about that, and I will talk about that. But I also wanted to talk about how we progressed, or at least how I progressed with working with you, Dana, and working with Monique in terms of communication, because we had sort of a bit of that topic discussed. And I wanted to tell you and just be forthright with you that, in the beginning of all of this, by trade, I'm an engineer. I always saw myself as a poor communicator, always super technical. And in sort of the process of building up this company, in the process of working with TCC and learning more about how to pitch and working with virtual pitch competitions, over time, I've seen a lot of improvement. And I just want to say that it's the improvement based on people like you who have helped me be this way that has meant a lot to me. And so realizing sort of that issue with communication, I've actually booked a flight out to LA to learn from a keynote speaker, to develop my skills in communicating, changing the different knobs and whistles with volume, the way to speak, pitch, tone, everything. And so I've been very busy, even before COVID. But I would also like to say that during COVID, this is a great time for anyone who's listening to take time to learn about anything. And if there's one thing to learn, it would be, I would recommend learning communication, learning how to pitch online, and learning how to control your voice. So I've been incredibly busy. With the start of COVID, so going back to your question, Dana, with the start of COVID, we were going through the Phase 1 of our AFWorks SIBR program. In fact, we were supposed to go to South by Southwest in Austin for this competition called Pitch Bowl. that changed because of COVID. In fact, that got canceled and turned virtual. However, the team was able to pivot, and we were able to present on our AFWorks Open Topic Phase 2 pitch. And we were happy to say that the pitch turned out pretty good. Our SIBR Phase 2 was actually selected, and it was selected for $1.5 million on a contract. The problem with that, even though we got selected, was that COVID applied travel restrictions, and our engagement with the Air Force is currently pending because of travel restrictions, because of issues with health. Mm-hmm. So in the meantime, to ensure that we continue on providing R&D efforts and aligning our work for the success of the Air Force, we explore different avenues of funding. The EIDL, the PPP, the LIFT Fund. And so we're continuing on with our operations to help support the Air Force with this next phase. But we are sort of bootstrapped still by leveraging all these different avenues of funding. For any startups that's looking to sort of so-called survive or continue on, I would suggest talking to your local SBDC or TCC center and exploring ways to get funding through the EIDL, PPP, or programs like the LIFT Fund.
Great, thank you, Roman. Lots of good points, especially about focusing on honing skills and learning about good communication. And of course, communication and pitch is so important for any new product. People have to know what you have and what you're offering before they'll be interested in even listening. So that's great. Okay, then on to Jenny with Terra Solar. You've been kind of all over the place in terms of your competitions and so on. You've talked a bit about the virtual and how you've had to adapt and so on. What has this meant, this COVID-19 impact meant for your product development, for gaining traction with potential investors, buyers, whatever? Can you address that?
Sure. We've definitely had to change our strategy a lot. I'm a people person, so my natural inclination is to just go out and meet people and, make contacts that way. So it's kind of weird that although people are more available now, to just be calling them up instead of meeting them in person. I remember Monique mentioned something a while ago that people in Texas have to see your face. You got to be there in person to be doing business. And COVID has changed that. So it's stepping out of the comfort zone and calling and making requests that I normally wouldn't be doing. And it's also been a lot of making really fast pivots. So COVID has slowed down a lot of shipping time for the materials that we need. It's made it more difficult to meet with different engineers that we have to. It has forced us to be in contact with each other as a team because we're working on something large that requires, people to be physically lifting, and because it's an engineering project, you've got to be there with your hands on it and working with people. So it's required a lot of trust from the team to be not, out partying and to be keeping themselves safe, to be speaking up for our own health and saying, hey, where's your mask? Where's your mask? The main thing is really about making decisions quickly, because we're in this competition where we were given 3 months to make a lot of progress. You can't sit and dwell on decisions. So just today, when we were putting up our solar canopy structure, we had planned to put it up outside of a mobile home, because one of the applications would be for small homes, cabins, mobile homes, RVs, things like that. But then when we got to the location, we found it was closed because a person had recently visited with COVID. So the whole place was locked. And it was like, oh my gosh, what are we doing? Because my deadline's on Monday. So this was the time when we were going to do our time-lapse video to show how simple it is to put up. So the decision made quickly today was, hey, right next door is like the cutest little house. It was so cute, like light green, blue door, big flower pots. We just went over there and asked this lady, can we put this up in front of your house and take a video? And she was like, sure. So that was lucky. And it's really just about getting out there and doing things that you're not necessarily comfortable with.
Wow, that is awesome. Thank you so much, Jenny. So to recap, we've had some really good points from all of you about making some changes in terms of your timeline. Like Bianca talked about, they're working on things that they need to do anyway, but they have an opportunity to get that done, and it will help them maybe speed up the process once your trials are done and so on, in terms of your packaging and everything. Did I talk to you, Ben? I'm sorry. I'm so bad about leaving people out. Excuse me. Our last but not least is Terra Biotech. Ben Johnson, thank you. Sorry.
No, it's okay. So sort of like you mentioned earlier, we're not an incorporated company yet. We're a senior design team that's looking at how to incorporate and to protect our ideas and our designs, and eventually, hopefully, maybe make some money from them. And the other thing that kind of complicates it for us is that all four of us are going to be continuing education after our undergraduate school. So like I'm personally starting medical school in like a month. Two of our other founders are going to get PhDs, one here in Texas and one at Atlanta, Georgia. And then our last person is getting a master in orthopedics, orthopedic devices. So we all like personally have timelines that aren't really getting delayed, but sort of like I mentioned before, most of our manufacturing and prototyping equipment has been blocked off from us. So we're not able to really technically develop it. And so like everyone else has been saying, we're addressing the things that we can. So that's why we developed like the video that you saw earlier. We're applying to more national competitions. We're trying to get more funding. We would have preferred to have more actual like technical data to support our functionality claims, but we feel like we have enough, especially given the circumstances, to where we're just going to keep applying for these other competitions and trying to expand our network and our impact, because we can't really go anywhere to develop the product further, just because the next sort of steps for us, like I said before, we're doing an infection monitoring device. So what we need access to are bacterial labs, which oddly enough right now are extremely busy. They really don't have any bandwidth for new projects, most of them, but we're still pursuing those types of contacts, both through the UT Health system. Here, we're trying to get we've got a couple of clinicians who are interested in running small animal studies with us. We're talking to immunologists and trying to find a lab that will allow us to do cell cultures and more microbiology type testing. And then in all of those conversations, our timelines are in flux because it just sort of depends on when things can get, quote, back to normal. So that's sort of where we're at. But in the meantime, sort of like everyone else has been saying, we're doing the things that we still have access to and that we might not have had access to if everything wasn't virtual because of COVID-19.
Right. Thank you, Ben. That's a great way to sum up. And the message has been very consistent across all of you, that while some people see this as maybe a barrier and a setback, you've each been able to see the opportunities in this particular time and take advantage of those and maybe rethink, refocus, and make the best of it. And in some ways, when things are over, whenever that might be, you'll come out maybe very far ahead, because as Gavin was talking about, they got a lot of work done very quickly, right? People were surprised about that. Okay, well, I think that's it for here, and I'm going to turn it over to Mini now.
Thanks, Dana. Yeah, this is awesome. So just to recap that last session, you guys have done new studies, new solutions, new funding opportunities, new skills, and a new comfort zone, right? So we have time set aside right now for questions. I have a ton of questions that I could ask, but I know that I want the audience and anyone else watching to ask away any questions of this brilliant group that is able to innovate during this time, not just with their innovations, but in terms of running a business. Jake or Daniela, let us know if there are any questions that come up, and I'll be ready to ask them. In the meantime, I kind of want to, like in the last session, the session before this one that the San Antonio SBDC did, and I see Crystal is on the Zoom call, which is really awesome. So I could call her if I need to. But I know, Roman, you worked with Crystal quite a bit on the PPP loan and or EIDL, and trying to figure out what that looks like for, a startup small business. And a lot of people disqualify themselves or say, well, I don't know if, I don't know if this is right for me or anything like that, especially for when you think, oh, it's just 2 or 3 of us, can we really apply for these things? Or, did it really affect me since I'm in the R&D phase? Talk to us a little bit about that process. And I know, every time you talk to us, you tell us how great Crystal is, and the SASBDC have been. But yeah, tell us a little bit about that. And then I'm fishing for questions also.
Yeah, so I think there's a lot of resources out there online, and Crystal had sort of prompted me to go into the government website, understand more about the EIDL loans and PPP. For us, we actually grew exponentially in 2020. And so there is a calculation associated with the amount of funds that you would get as a small business based on duration of time that could be applied from 2019 to 2020. I would recommend talk to a professional to get the numbers appropriately, assigned and sort of applied. But ultimately, you would have to go get sort of your payroll documents in place to get the PPP loan. In regards to the EIDL loan, that's pretty easy. You just go online. I don't know what the website is, and Crystal, you might want to tell me, or Monique, if you have that website, that would be great to share. You would just simply go online and apply for the EIDL loans. It's my understanding that they, as in the government, recently opened up that platform again for any company, small business that hasn't already received EIDL funds. And so, yeah, going through those 2 avenues, getting the paperwork prepared and ready. Yeah, thanks, Crystal. Thanks for putting that link. Yeah, those are 2 avenues to get additional funding while surviving during COVID-19.
And directly related to COVID-19, Jenny, you are at Can Opener Labs, and you guys have even been in the news. Tell us a little bit about, like you being where you are in a product development center. And so you guys had access to 3D printers and welding machines and all of these things. Well, tell us a little bit about that.
Sure, that was wild. So almost immediately after I found out that we're in this Department of Energy competition, everybody went into quarantine. So I had moved into my office, moved out 2 days later, and then Can Opener started working on an emergency ventilator project and also collecting materials and organizing resources for face shields. So then came back, and then the next 3 to 4 weeks was only about emergency supplies for the city, because that was at the real scary time when we didn't know, are we going to run out of ventilators? Is this just going to blow up massively and, be so tragic for the city? So that was a crazy time. And I can't even express how heartwarming it was to see the outpouring of support and how many people kept calling and emailing and everything. What can we do to help? What can we do? There were people dropping off 3D printed the forehead part of a face shield that was later assembled with the plastic part. But there were so many people around town who were part of this. There was a group of librarians at elementary schools. I guess Northeast ISD has a bunch of 3D printers at their elementary schools. So all these librarians were just on it, and they would clearly organize their time to drop off because there would be like this meeting in the street of librarians who were like standing apart yelling at each other. But seeing this was incredible, and it really, it just showed the beauty of the city, and it helped, I feel like, advance my solar project, even though we were not working on it for 1 month out of this 4-month competition, which made it really scary. You know, we just learned how to innovate so quickly and how to get the team together, how to get everything rolling fast. So it, to me, was not in any way a hindrance for our development at all.
Nice. And Gavin, can you talk a little bit about, you know, like you had on the horizon, like this is something that we want to do, but this kind of forced your hand in terms of what this is in the pandemic, forced your hand into which direction you're gonna go and beta testing, right? But it also helped you to focus on COVID-19 solutions. So what was it like with your team looking at COVID-19 and realizing that you actually have a solution for this?
That's a great question. I think one of the things that we did as soon as COVID happened is we reevaluated what the major challenges were as far as what we were trying to solve in healthcare. So obviously our issue that we've decided to combat is non-adherence. And with a paradigm shifting event like this that was unexpected, we were searching for ways that would impact healthcare. And based off of some of the research that we did in January, when it looked like things were going to start or were likely going towards self-isolation and lockdown, is we started having conversations with pharmacists in the local area and talking to them about what that may cause. And all of them were saying that they're going to have to accommodate and move towards remote delivery, remote refills, and other ways of trying to get people to take their medication properly and still take it in a time when, you know, they can't check up on them and they aren't coming to the pharmacy and they aren't able to provide the same level of care and support as they were before. And so when we heard that they were doing that, and then we saw that some of the large retail pharmacies around us, CVS, Walgreens, Walmart, and HEB, were all moving towards mobilizing remote deliveries for patients across the board. We saw that as a really big opportunity because one of the things that you want to make sure of is that in a time when going to the emergency room and getting hospitalized can cause someone to be in contact or be infected, you want to make sure that people are taking medications properly, because non-adherence in 2019 caused 15% of hospitalizations in America. So over 1 million hospitalizations in America were only because people took either too much or too little or none of their medication at all. And sometimes, you know, with certain cases, it can be missing 1 medication out of 5 that you're taking. So a simple slip up can cause someone to be hospitalized. And for elderly folk who may need to go to the emergency room or be hospitalized, it can be life-threatening to be put in a position where they're in close contact with COVID. So not only were people going remote and looking for remote health solutions, which we could provide, they were also looking for a way that would keep hospitalizations low and allow for people who are self-isolated from their friends and family and loved ones who they'd normally be taking care of, for them to feel at ease knowing that they could open up an app and be able to see, have up-to-date reminders about whether their grandparent or child or friend or family member had taken their medication that day. So that's kind of what we did at the early stages. We realized there was a change coming. We talked to the people that were going to be our end clients, in the pharmacists and that were around us, got a sense of what that might mean if those changes happened, and then started preparing to make sure that we were solving something for them, and we're making something that would make sense, and help ease some of the burden that had been placed upon healthcare workers. So does that answer the question?
Answers perfectly. Thank
Great.
you. And Bianca, I'm gonna kind of switch a little bit from COVID, like COVID-19 impacts, even though it still is, but you guys your process is not a short process. Getting from your, all the way to, like nipple generation, like that is a long process.
Yes.
And so with that, when something like this, like a pandemic hits, I kind of have two questions, and I think this will be especially important for anyone in the health innovation space. How do you keep your team, like morale and just keep going? That's on one side, and then the other side, I think, actually, yeah, everyone on here is. You were a scientist engineer first, and now you're a business owner. So, how do you're now a business owner, you're in charge of people, how does that, so you have to keep your morale up, but also your teams, and as Roman was alluding to earlier, if you're in the engineer space or the science space, you can just work on your projects typically, but not as a business owner. So can you talk a little bit to us about that?
Yes. So I think one thing is to make sure that you really celebrate the wins that you have. So like we recently found out that our patent is being awarded, and this has like been a 5-year-long process. So we were like, yes, something good, something to celebrate. And of course, like that, boosts morale. But I mean, yeah, it's hard. It's hard for everyone right now. Like, I mean, I have a 3-year-old and a 5-year-old, and their daycare has been canceled for a month on end. It's just, life is hard for everyone right now. And I think just keeping that in mind and giving yourself extra grace and everyone around you extra grace, I think that helps, just realize that, this isn't forever. It will end sometime, like even, if things aren't perfect and they aren't the way that you want them to be, I think more than anything, it's important to just keep moving forward. And I think, we've all demonstrated that as long as you just, try something, do something, just don't give up. I think that's the biggest thing. But yeah, keeping the morale, like it's hard. I'm not gonna lie, it's hard, and but what can we do, and I know that we're all working on things that are deeply passionate to us. So just, keeping in mind like why you're doing what you're doing, and I mean, for us, like we've interviewed so many women who, gone through breast cancer, and we've had them donate to us. So, I mean, they're still, being like, hey, how's it going? So I think that just keeping that in mind helps you stay motivated on the long trek. And I think that's true just for science, biotech, health related things in general, because it's a long haul. I mean, most things take, 5 to 10 years at least to get commercialized. So just, keeping that fire in your heart to know why you're doing what you're doing helps you stay motivated.
Awesome. And Ben, I know that you guys are kind of in flux of, like, what do we do next? So instead of asking you a question that I had, I'm gonna see if you had any question to any of these experts. So I'm putting you on the spot, but I feel like I see your brain working. Yeah, any questions for them to help you and your decisions? Because Bianca was at UTSA and Patch was, at Gavin was at Trinity, recently. And so they can talk a little bit about, transitioning from, being a student and having an idea to where they are now. So I'm not saying you have to direct your questions to them. I'm giving you options.
Okay. The first thing I want to say is, even from our like baby perspective, I totally want to echo what Bianca was saying, in that sort of for us, our perspective was not only did we have all this happen, but we were slogging through it, and then everybody graduated. And so the momentum was just like, and nobody wanted to really do anything for a couple of weeks. And so we sort of, as a team, sort of let everybody go do what they needed to do for 2 or 3 weeks. And we said, okay, on this day, we're going to come back and we're going to figure out what we're doing next, because we're not going to just drop this. So I totally want to echo that. Like, you got to give people space to do whatever it is they need to do to like personally survive. But staying in contact with the patients and the people whose lives you can make a difference in through your company, especially if you're in a healthcare related facility, is a big deal, right? So like for us, we were talking about how these epidemics seem to happen on a pretty consistent basis. And even if they're not directly respiratory related, they are still impacting on in an immunological way on a community. So at-risk groups will see cyclical rises in hospital admissions every 3 to 5 years because of one of these pandemics happening. And so that's kind of what we talked about for our motivation was, hey, if we can actually get this stuff together, we will actually save people's lives. So that's sort of a way for us to keep our momentum going and remind everybody why we're here. If I could ask questions about these guys, sort of like I mentioned, because we're not able to do more technical development at this point, we're kind of in the act of balancing how much or how many people we want to bring on board, basically, because like I said, every one of our founders has like further academic or career development that they're doing before they can just do this full time. And so we're talking to physicians, to entrepreneurs, and everyone else. And especially from some of the physicians and researchers, and if any of them are watching this, not anybody specific, but we sometimes get the sort of feel like they're trying to get into our project, if that makes sense, without really contributing a whole lot. Like they're just trying to get in on the boat, and then they'll start maybe helping like later once we've gone through more of the process. And I'm just wondering if you guys have tips on sort of how to navigate that, figure out like who you need to bring on and why. It's obviously going to be really specific, but that's in general in a couple different interactions, something that we're trying to handle right now. Even outside of COVID-19, we're going to have to make those decisions. So how do you decide who to bring on and why when you're sort of at we have an idea, we have a prototype, and now we got to try to actually get somewhere to the incorporation level?
So I'm going to chime in on the mentorship or involvement of other parties. So I think it really depends. So you're going to need certain people at certain stages of your development, right? So like the mentors that we had when we were first starting, we were like, what's an LLC? What's a C Corp? We had no clue about anything. Those are going to be different people than when you're at the stage where you're doing like animal studies or you're getting an FDA application, submitted or anything like that. So I think you have to keep that in mind about, how this person can help you, what stage are you at now. They may be someone who, maybe right now is not the best time, but you can still like keep them involved, keep them as a mentor. And then when you get to the stage where they can have the most impact, then you bring them on at that point. And that's kind of what we've done. And just, like keep them involved, keep them updated on your progress. But then when it comes to like, legal, financial components, like make sure that you have worked with them for a little bit. So you know that you can work well with them, that everyone gets together well and everything like that, and then make that decision at the point where you feel like it's beneficial for your company.
Okay.
If you don't mind, I could chime in on that as well. I think what you're looking for is sort of a trade, right, for mentorship and also stake on the company. I would recommend creating an entity. There's different platforms to create an entity. You could use Gus Launch, you could use Atlas. There's online platforms that you could simply sign in to create a Delaware C Corp. And when you have a Delaware C Corp, you could issue stock grants to individuals who have significantly contributed to the progress of your company. And that is one way to compensate them without necessarily having to pay them monetarily. I would venture into exploring that, and also venture into exploring contracts with these individuals to isolate and identify, hey, this person can contribute this for the long term of my company, and in exchange, we will give you X amount of stock in the company.
Everybody's not in their head.
Yeah, that's legitimate. Yeah.
Yeah. Anybody else have anything else to add on that?
I was going to say, make sure that whatever compensation that they will receive is contingent on either performance or metrics or something like that, instead of just, you know, they get it all up front and then they can walk away or whatever the case may be.
Right. Yeah.
Yeah. Awesome. Thank you guys for answering that. That's a great question. That was a great question, Ben. And I know we're about to wrap up. I'm gonna throw it back to Dana in a second to wrap up. I didn't see any questions come in. Jake, right? Yeah. Okay. So you know, before we are cut off, one of the things that I wanted to mention is that we love these discussions, you know, TCC, these are 3 of our clients, but our clients range all over the place. And we absolutely love when we get to network and have all of our conferences and workshops. I think we prefer, you know, if we didn't have to share any content and just have people network, we could do that. Or you learn so much from talking with each other. And so that's something that we really want to emphasize, you know, Ben, is with our clients, you know, being able to talk with each other, being able to network, being able to, of course, get our assistance in whatever aspect they're doing, is something that we really value. And we get to partner with a lot. So we really appreciate partnering with Launch SA. Crystal Darby is on the call also. She's from the SASBDC. We are partners with the Small Business Development Center. So I do want to tell you, you know, and we'll get with you later on, you know, we'll help you through that entire process. Bianca can tell you when she first went to Bijo, who's our director, who's also on the call, what they were like, you know, coming out as students, and then now, you know, what they've done and how much they've accomplished is pretty amazing. So we kind of wanted to make sure that you guys, you know that we are available. And the other thing Taylor just reminded me of is, don't forget your feedback form. Launch SA really needs it. We really want you to have it. So anybody that's watching, if you're watching post this live event, please give us feedback. Let us know any of that information that could help you. Please let us know. So Dana, did I miss anything?
I don't think so. This has been really awesome. So many kudos and thanks to all of you. Allison's, Novice Helium, Terra Biotech, Patch, and Terra Solar. You're all just so inspiring. You're at different points in the business journey. You have amazing technology and innovations and services and so on. And we want to wish you all the best. And we, now that we have hold of you because you're in our mailing system, we're going to let you know about other competitions, other opportunities, things that we learn about that we think that might be useful for you. And please tell people that you know that perhaps are looking for business assistance to consider SBDC's, Crystal being a representative, and us as a specialty center for science and technology companies. But thank you again so much for your participation and your great insights. And we're hoping that things go smooth. They may not, but you all have fabulous attitudes, and I have not a doubt that you will make it work. So thank you again.
Thank you, Dana. Thank you, guys. Honestly, this session brought a different perspective. I think everyone has, like Dana mentioned, different insights on what you're going through as a company, different fields, different industries, and how it has affected. And I can see that all of you have found a way to kind of look at the brighter side and making sure that the time that you have right now is well spent and moving forward. And as Gavin said, coming out, like just showing your contacts that you're one step ahead after this. It's not that you just resume operations. So thank you everyone. Thank you everyone at UTSA, great partners. This is just it for one reason, it's not good that we do it every year, but I think it's just refreshing to catch up and see what you guys have and any other resource that UTSA has and that LaunchSA has for small business owners. You can go check out on our website. By filling out request assistance, we always refer small business owners to resources like the ones that you just described. So thank you.
And Daniela, let me say thank you so much to you and Ryan and your team for putting on this great week full of really wonderful content and stories and all kinds of advice and maybe tears as well from things that haven't gone so well, but great successes. This has been a fabulous opportunity. Thank you for letting us be part of it.
Thank you, everyone. Have a great rest of your afternoon. We do have one more day tomorrow, so
Daniel,
we can't hear you.
You can't hear me?
we can now, I think.
Yeah.
Okay, sorry. I was just gonna say we have one more day. Last day, we're gonna have cybersecurity with SDA and open security.
A little bit. Sorry.
Sorry, I'm sorry. You guys can hear me now?
Not quite.
Okay. Well, is it better?
Not yet.
Oh. Am I in my headphones?
I think you were telling us a little bit about what's left for the rest of the week.
Yeah, I was just gonna say tomorrow we have cybersecurity with SCA and open security, and then also the vendor orientation that the small business office of the economic development part of the city usually does. So if you're interested in seeing what the small business office has to offer as opportunities right now, it will be a good way to engage with the city. And we have a lot of session on right sizing the new way of work. So all of those people that are looking how you manage your team and how you grow a team with like limited space or now remote, right? So I hope you can, if anybody's interested, catch that, and if not, it will be available on YouTube on our playlist. As this session.
Awesome. Dana, I think you're muted. I don't know if you were saying something.
I was just going to say, I think in translation, we should check the program online and see what's on for tomorrow.
All right. Thank you.
Thanks again, everyone.
Bye.
Thank you.
Bye. Thank you.